now we're going to start talking about middle age, and this chapter in your book is called Biopsychosocial Challenges, which essentially means physical, cognitive, and social emotional development, all in one chapter. So this is chapter 13 of your book. First, we're going to talk about physical changes. Okay? So physical changes in middle age, a lot of appearance changes. We start to see the appearance of wrinkles. This is caused by changes in skin and its connective tissues. It's also due to the cumulative effects of damage from sun and smoking. So if you're out in the sun a lot or if you smoke, then you're more likely to show wrinkles sooner. We also see gray hair. This is completely natural. It comes from the pigment production in the hair follicles decreasing. This could happen to someone in their 30s, it could happen to someone in their 50s, it could never happen. Some people in their 20s get gray hair. It really changes based on the individual. We also start to see male pattern baldness. This is genetic. Usually starts at the top of the head and spreads out, and this usually begins in middle age. It tends to come from the mother's side of the genes, so look at your mother's father, and if he is bald, then most likely you're going to have those genes for male pattern baldness. And we start to see weight gain. Most people gain weight between their early 30s and 50s as their metabolism slows down. There are a lot of changes to the bones and the joints. One of the biggest is osteoporosis. Bone mass stays the same in people until women start menopause or men reach late life. For women, the rapid loss of bone mass in the first few years after menopause starts. Okay? So this just leads to weaker and more brittle bones, so they're easier to break. Osteoporosis is the extreme of this. Bones become more porous and easy to break. It can also cause spinal vertebra to collapse, causing a person to stoop and become shorter. I'm sure you've all seen older people walking around with a stooped back, or people who actually get shorter as they age. This is part of it. Osteoporosis is caused by having low bone mass at the time of peak bone growth, deficiencies of calcium and vitamin D, estrogen depletion, which is why women get it in menopause, and the lack of exercise that builds bone mass. So if you want to prevent loss of bone mass in your older years, then you should be exercising now. Women in late middle age and over 65 should have their bones tested. Osteoporosis affects women more than men. Another common complaint is arthritis. Beginning in your 20s, cartilage and joints starts to deteriorate, thins, becomes cracked or frayed. If the bones underneath the cartilage become damaged, you get osteoarthritis. According to your book, osteoarthritis is the most common form of arthritis, marked by the gradual onset of bone damage with progression of pain and disability. So that just means that it starts small and gets worse, together with minor signs of inflammation from wear and tear. Osteoarthritis usually occurs in late middle age or early late age and progresses very slowly. It's more common in people whose joints are overused, such as athletes and manual laborers. It usually affects the hands, spine, hips, and knees, the joints that are used the most. Another form of arthritis is rheumatoid arthritis. This is a more destructive disease of the joints that typically affects different joints and causes different types of pain than osteoarthritis. Rheumatoid arthritis is usually felt in the fingers, the wrists, and the ankles. There's no cure for rheumatoid arthritis, and it's not limited to older adults like osteoarthritis is. Children can have RA, and it can be a very painful disorder. Okay, reproductive changes. Climacteric and menopause. So climacteric is the biological process during which women pass from their reproductive to non-reproductive years. So it's the whole process of a woman losing her ability to reproduce. Menopause is part of the climacteric, and it is the point at which menstruation stops. It is complete when periods have stopped for 1 year. So in our language, we tend to use menopause to mean the whole process, when really menopause is just a specific part of the process. The whole process is called the climacteric. The major reproductive change in women is the loss of the ability to bear children. This begins typically in the early 40s and is usually complete by 50 to 55. Perimenopause is the individually varying time of transition from regular menstruation to menopause. So in this period, you haven't fully started menopause yet. It's the pre-menopause. Estrogen and progesterone levels decrease, reproductive organs change, and sexual functioning changes. It's just a change of hormones that heralds the arrival of menopause. So symptoms that women have, decreases in hormones may lead to hot flashes, night sweats, headaches, mood changes, difficulty concentrating, low libido, etc. Many women report no symptoms, but most women have at least some. So it really varies woman to woman about which symptoms they have and how severe they are. There is hormone therapy for menopause. This is medication therapy in which women take low doses of estrogen, which is often combined with progestin to counter symptoms associated with menopause. There are benefits and risks to hormone therapy, just as there are for any type of therapy or medication, so it really should be up to the doctor and the woman to decide whether or not she needs it. So now let's talk about the reproductive changes in men. Men undergo gradual changes as they age, but nothing as extreme as women. We see a gradual decline in testosterone, but most men never experience total loss in the ability to father children. There is a decline in sperm quality. Okay, so men who are older have more risk factors for children who have something wrong with them genetically. But men in their 80s can still father children. Prostate gland may enlarge and may block the urinary tract, so that's why you hear a lot of older men who have trouble urinating. And prostate cancer becomes a concern. Their sexual desire and performance decrease. I'm sure you've all heard the commercials about erectile dysfunction. For women and men, an active sex life is possible as they age, but the most important ingredient is a strong relationship with a partner. So even with the physical changes, it is still possible to have a fulfilling and active sex life. Stress and health. Your book talks about the stress and coping paradigm. Middle age is the most stressful time of life. The lowest stressful time of life is over the age of 65. So why is middle age the worst? Well, there are a lot of financial pressures in middle age. For example, children might be going to college that they have to pay for. They often have ailing parents that they have to take care of, marital issues, work issues, etc. There's a lot going on in middle age, and it can be incredibly stressful. So how is the stress handled? So the definition of the stress and coping paradigm is the dominant framework used to study stress, which emphasizes the transactions between a person and his or her environment. In other words, stress is an interaction between a person and an event. How do you react to a stressful situation? It's not the situation in and of itself that's stressful, it's how you react to it. So other circumstances matter. Are you already late, stressed about something else? These circumstances may change how you interpret a situation. So a situation by itself is not stressful until you interpret it as so. So normally, driving through a construction area may not be incredibly stressful, but if you're already late for work or something big is going on at home, then you might interpret that event as much more stressful than you normally would. Now for the coping part of this. Coping is any attempt to deal with the stress. Some people cope by trying to solve the problem. Others distract themselves or try to redefine the situation. Coping on an emotional level means focusing on how the problem makes you feel. And there are a lot of religious and spiritual approaches, praying, meditating, etc. People have a lot of different coping mechanisms to try to help them with stress. Some people exercise, some people meditate, some people distract themselves by doing a hobby. So let's talk about the effects of stress on your physical health. So chronic stress, that means you're having stress all the time, suppresses the immune system. It increases the risk of plaque buildup in arteries, which can lead to heart problems. Hypertension, which is high blood pressure, and it can lead to impaired memory and cognition. This is all due to the stress hormone cortisol. It does nasty things to your brain. So people who have cortisol all the time suffer these negative effects on their health. What are the effects of stress on your behavioral and psychological health? Well, stress can trigger psychological reactions, anxiety, nightmares, emotional numbing, insomnia, etc. There are a lot of different ways for stress to manifest psychologically. The most extreme of these is PTSD. This is post-traumatic stress disorder. According to your book, this is an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. Now, your book just talks about this referring to physical harm, but people who have suffered a severe psychological or emotional trauma can also experience PTSD. It's not limited just to physical harm, even though that's what your book says. But some of these physical things that can trigger it might be violent personal assaults, natural or human-caused disasters, accidents, combat, etc. PTSD affects nearly 8 million Americans. It can be debilitating. Some people cannot function with it, but not everyone is affected by it. The treatment for PTSD, psychotherapy, maybe with a little bit of antidepressants, but therapy is probably more effective than the medication. Now for the idea of mindfulness. So mindfulness is a form of stress reduction based on being aware and non-judgmental of whatever is happening at the moment. It's about just being in the present and acknowledging everything that's happening and everything that you're feeling, but not judging it as good or bad. There are many books about mindfulness. There are many approaches to mindfulness, and it's part of the positive psychology approach. So if you study positive psychology, you'll probably learn a lot about mindfulness. Yoga and meditations are some forms of this. Research indicates that it has positive effects on physical and psychological health. It results in functional and structural changes in the brain. So mindfulness activities can physically change your brain, especially in areas responsible for stress, emotion, attention, memory, and sensory processing. So not only can they help you in the moment, they can change your brain to function better overall. Mindfulness is a really powerful tool. Exercise. Regular exercise can slow the aging process. Aerobic exercise, the type that increases your heart rate, is especially beneficial. Adults should get 150 minutes per week of moderate aerobic exercise, 75 minutes of vigorous exercise, or a combination of the two. And they should get strengthening exercises twice per week. When adults meet these guidelines, they show improved cardiovascular functioning, maximum oxygen consumption, lower blood pressure, and better strength, endurance, flexibility, and coordination. So it helps in a lot of physical ways. Psychologically, adults who exercise this much have lower stress, better moods, and better cognitive functioning. Exercise releases endorphins and other great hormones for your brain. Just like cortisol is bad for your brain, these endorphins are really great for your brain, and they help you not just physically, but mentally and emotionally. We'll continue in the next video.